Welcome to DLC Wellness. Structural dysfunctions can be a barrier to optimal health and are a very common finding in people with metabolic disorders. There are many factors that can have an impact on the structure of the spine. These can include lifestyle choices, genetics, gut dysfunctions, soft tissue injuries, imbalances in brain activity, emotions, muscular imbalances, endocrine disorders, immune imbalances, and many others. These structural dysfunctions can manifest as rotations and translations of the head, shoulders, torso, and hips along various planes. These discrepancies are maintained as the person stands up as straight as they can in a neutral anatomical position. In other words, a shoulder or hip can be higher than its counterpart. The head can be tilted to one side, a pelvis can be rotated to one side, one leg can appear shorter than the other due to muscular imbalances when a patient is placed on a treatment table. This can be a finding in a patient with knee, foot, or lower back pain. These are all common findings when one has pain anywhere in the body. The overall structure can also tilt to one side, but still manage to stay erect. The head can also be translated forward and stuck in that position. This can cause greater structural dysfunction over time. A body that is balanced will function better in various ways. Several methods are used to bring about this balance in all patients at the DLC Wellness Clinic. Today, we will discuss one of these approaches. If you suffer chronic pain, including migraine headaches, and have lost hope, the Atlas Bioscan technique may be able to help you. It is one of several passive biofeedback techniques that were developed at DLC Wellness. The Atlas Bioscan procedure is a passive, three-step biofeedback technique for upper cervical analysis and correction. The three steps are analysis, correction, and post-treatment reassessment. It is an important component of our program for metabolic patients. If the head has shifted off-center, the spine will compensate as muscles make an effort to keep the body upright. Numerous problems can develop throughout the body as the spinal structure shifts off-center, causing the body to compensate in various ways. Headaches, spasms, tingling, or pain in the extremities, poor posture, and chronic aches can all result from the head and neck being out of normal alignment for prolonged periods of time. Clinical research has shown that spinal misalignments can be improved by using the atlas vertebra, the highest vertebra in the spinal column, as a lever. Appropriate treatment at the upper cervical region is frequently overlooked by medical professionals and rehabilitation specialists. This small vertebra weighs only a few ounces, and yet it supports the head, which can weigh up to 15 pounds or more. In other words, the average human head can weigh as much as a bowling ball. The Atlas Bioscan procedure reduces constrictions throughout the spine, but the most critical area is at the foramen magnum. The foramen magnum is the opening at the base of the skull where vital neurological and vascular tissue traverse. The apertures of the atlas and foramen magnum can overlap and encroach on the vital soft tissue within it. It is here that the brain stem exits to become the nerve bundle that is known as the spinal cord. The neural pathways to and from the brain have a clearer pathway when the head and neck are properly aligned. The atlas will compensate for spinal misalignments below it and for head position above it by translating and rotating along sagittal, frontal, and transverse planes. A gentle, sustained, and controlled pressure is applied after the analysis at a specific area in the upper neck region to shift the vertebrae into alignment. The correction is performed at a vector that is unique to the misalignment. The correction will bring the head and neck back toward its correct anatomical position. Spinal misalignment patterns are unique, like fingerprints, in all individuals and must be determined accurately before any correction. the upper cervical region requires precise corrections. The goal of the Atlas bioscan technique is not only to center the atlas to the foramen magnum of the skull in different head and body positions. It is also important to determine and correct factors within the body that can affect overall structural integrity over time. The patient will benefit when they find a practitioner who can manage complex conditions with multiple approaches. Random mobilizations on both sides of the neck and neck massages will not result in a correction. Accuracy and precision are the keys to a positive outcome. This procedure is exceptionally gentle and does not involve any random thrusting, cracking, snapping, or popping of the neck. The Atlas bioscan technique will not stretch ligaments beyond their normal capacity or create other soft tissue damage, which can lead to altered cervical biomechanics and instability. The exceptionally gentle nature of the Atlas bioscan procedure may be one of our many approaches that can help to put you on the road to recovery. Thank you for your time.